Good evening, everyone, and thank you for joining in on time. We are very happy and honored to have Dr. Pedro with us today for a short webinar. Yes, it's for 50 minutes. However, I'm pretty sure that all the information that are going to be provided in this webinar is going to be fruitful for everyone. Now, honestly, I am very honored to know Dr. Pedro. He's from Brazil, okay, and we have a lot of anterior and posterior dentists that are we call them artistic dentists when they reshape the composite, whether in the posterior teeth or the anterior teeth. You actually, as an experienced dentist, sometimes get confused whether it's a direct composite or an indirect restoration. And we can see this very clearly on Dr. Pedro's page, all the artistic composite restorations that he has designed and put for us over there. We also know that he has his own project called Morpho Guide, where with his book and his materials, he guides his students or his colleagues step by step how to actually replicate the natural tooth structure. Without any further ado, the microphone is yours, Dr. Pedro, and thank you very much again for having with us this webinar.
Hello, good evening, everyone. Thank you, Dr. Ayat, for the invitation. It's a big pleasure, big honor to me be here today. And I want to say hello to everyone. I know that's lots of people from all over the world. Starting with my presentation. So I really want to share some details for you, and then we can start to the live demonstration. Okay, I will share my screen. Just a moment.
Yes, we can hear you and we can see you. The stage is yours,
Okay.
Doctor.
Thank you. Well, here's my face. I'm Pedro Sachet from Brazil. I'm a dentist since 2013, and I'm very excited to talk about morphology. That's a subject that I study a lot and spend so much time. And now it starts to make people start to know me from Instagram, and I'm very happy to be here today. So when we talk about dental morphology, then natural teeth is always going to be our inspiration. So we have a lot of informations on a picture like that. All these images are pictures from replicas of natural teeth. So that's our observation point. Every time we have to do a restorations, natural is going to be our inspiration. So nature is amazing because nature broke some patterns that transform teeth in a very beautiful structures, and it's hard to reply these structures. So in the first moment, we're going to need to make more simple restorations. So we're going to studying, we're going to understanding the structures and starts to variate the morphology. So I really like sculptures because you grab a raw material and then you apply knowledge and technique and transform with the right tools in something useful, something beautiful, something artistic. In our case, is even more special because we transform resin, for an example, in a patient's prosthesis. You can give him back a function for our patients and giving back self-confidence. So our profession is very, very special because of that. So, what is necessary to improve our level? I list here 3 points that I think is essential. First of all, study. We have to study morphology because without the restoration in our head, we aren't able to build in the patient's mouth. So we need to train hard, but if you train without study, it's only repetition. So you can spend 10 years training the same thing and not getting better. And the third point is patience. A big friend of mine, Lucas Ferradans, they always said this phrase: "Be a dentist takes time." So we need to be patient and train a lot because our professionals is endless stairs. So the my objective here is to work with your perception. So our perception of life, of shapes, impacts directly on our restorations. So when we saw structures like discussed, we need to imagine how we are going to be able to reproduce these structures on wax, on composites, whatever. That's our objective here. So I'm going to explain a little bit about the technique that I'm going to show to all of you. We have here occlusal surface to restore, and that's the side vision. So I will start with a dentin layer. I just need that this layer be smooth and concave. Then I will make some mark just to for the orientation of the cusps proportions. And I start to apply resin cusp by cusp. So in the first moment, I just need to cover all the structure of this cusp without getting concerned about the limits or the marks and whatever. It's just to fill the whole cusp. Then I will start to throw the resin for inside because if I start to press the resin here, the resin should be on this direction and I don't want it. So I start to invert this resin with a delicate spatula. Look. And then when I press the resin here, the resin is going to do like a little roll. And that's going to make for me, sorry, a more natural groove. So here I have my limits, respect, my ridges, and my marks. And I have space here for the proximal lobes. Now I start to press with the brush, gentle press these structures because I need to give the effect of secondary sulcus here, secondary fissures or secondary grooves. So I start to press with the brush and then I can control those inclinations. And we starts with this picture, and after this press, we have this situation. So we have the illusion of here is secondary grooves. So the most important that is I'm not cutting the resin, and it's gonna be easier to our patient clean the surface or to me polish the surface. That the one of the most important things that I need for the long term long duration restorations. So here I put a mesial lobe, then a distal lobe, then I go to the palatal cusp. the same sequence as the first cusp, but now I have to take care about the groove. So I spread the resin. You can look that the groove is not well defined. So I will open the sulcus, this groove, sorry, and then I will close this resin again. So with the brush, I start to press over here with gentle moves, and then my resin is going to close the groove. So it's easy to patient to clean the surface, it's easy to me to polish. So and that have a nice and natural look. So that's basically that. And then we can add something to make the fossas, make the illusion of our fossas is deeper than actually is. So if I put the tint is going to be on this plate. It's a very, very delicate path. Something like this. For our demonstration today, I choose a second lower molar. That's a teeth that I really, really like to do. And that's the same sequence. Denting, I'm going to spread the denting. Remember, here we have to have a smooth and flat and concave layer. I will make some marks just to oriented by proportion of the cusps. So we start to cusp by cusp restoration. Here I made these details with the brush, and then I polymerized this resin. Then I keep adding resin to other cusps. Basically, that's no secrets. All the teeth we going to do the same configuration about the cusps, and that's what I told you before. We have to think to have this image in our head before the restoration is complete. Okay, so we can talk. We can go now to the demonstration. Dr. Ayat, are you there? Can we
Yes,
change
doctor, I'm here with you.
Can we change the image?
Of course, Mr. Amin will change it now for you. Yeah, I think it's ready.
Nice, nice. Can you hear me?
Yes, we can hear you loud and clear, doctor.
Okay. We have just a light limitation because I need to use this orange light for not
It's
polymerize
clear,
the
doctor.
resin.
It's of course it's clear.
So for the dentin, I will use a clear fill resin that's from Kurai, and I will do this second lower molar. So exactly the same sequence that I show you on the slide. Well, I will start putting the dentin layer. And remember, I just need a smooth surface. I'm going to spread with all these instruments that I use. I can answer if someone needs to know after the demonstration. But it's just to spread and make the smooth surface.
Doctor, what shade do you usually use for the dentin layer?
What shape?
Shade.
Shade, sorry. I like more saturated dentins. So I use A3, A3.5, A4. I really like more saturated dentin.
Okay.
I'm gonna make the orientation marks. So I know that the central fossa of the second lower molar is not in the center. It's a little bit uh, lingualized. So I'm going to divide the two lingual cusps, but I'm not going to use straight lines because nothing is straight in our teeth. So we're going to do some curves here. I'm going to divide the mesial cusps. Going to divide the buccal side. And now the distal cusps. Okay, I'm going to light here in my restoration. And for the enamel, I'm going to use the enamel from Care, A1 or A2 shade. That's what I'm normally use. So that's exactly the same as the images. I need one good amount of resin to cover the cusp. Now I start to invert the resin. That's I don't think it's a secret, but that's what causes the natural effect on the grooves, mainly only on the grooves.
I think it's a very
So
important tip, doctor. Even though I attended a lot of demonstrations, this is the first time I hear about the inversion of the composite itself.
let me try to show by this vision the inversion. No, when I invert the resin, the tendency is the resin to go up. So I need to control this inclinations. Let me start to pressing with the brush. So the brush, it's going to be using like a condensator or something, not as a brush as well.
Do you apply anything on the brush, doctor, or it has nothing
No,
on it? It's dry.
that's a little bit of resin here, so it's the works like a condensator, you know.
Yes.
It's not good for anterior teeth, for an example.
Mm-hmm.
And then I start to make this like a secondary groove, you know. I can like fold the resin. I don't know if that's the right term. But in this phase, I can start giving the shapes that I have in my head, you know. This
Mm-hmm.
inclination is very, very important. So remember, we don't have straight lines. We can make a little curves with the brushes. It's very, very delicate, but it's not difficult. You have to agree with me that the hand skills are not the most important here because the movements are so basics. But we have to have in mind the final shape of this restoration. So I think it's okay. I'm going to activating. People of ask sometimes if I do this on direct restorations too, and it depends of the size of the cavity. I rarely do a direct restoration of this size. No? When I have a cavity so large, I'm going to indirect restorations. So I have more time to build the structures and a better polishing, or this is my reasons. So now you can see I'm applying resin over the sulcus. I'm not concerned about that right now. And now I'm start the inversion again. Look, that's the reason I need to work with hard resin. Cannot be so soft resin. I will open the sulcus again.
Do you have a preferred cusp to start with, doctor? So, for example, let's say we have this large cavity, and where I am a biomimetic dentist that believes in adhesive dentistry and would not go for an indirect restoration. Which is there a sequence of the cusp names that we should follow, or we can just start with any cusp?
Well, I think we can start with any cusp, but it's from people to people, you know. I have this order, but depends on the detail that I want to reproduce, you know. So in the lower molars, I ever start with the mesial buccal, then I go to the mesial lingual cusp.
Mm-hmm.
But I think it does not matter at all. Now I have to close the sulcus. Look, and I am concerned here with the direction of my triangular ridges. That is amazing. That is so important detail. I need to visualize the point of the cusp and the main groove. So we have triangular ridges here. My transversal ridges over here. Now I'm start to thinking in occlusion as well. So I need to think that I have a upper molar that's going to bite here. So I need to know and I need to give the same inclination for the cusps on I have the contact, you know. So it will inquire on my secondary grooves locations, sorry. So here with the brush, as you can see, this inclination I start to make my marginal ridges. So the light is always going to guide me. If I have this light, means that I have two inclinations and means that I have a well positioned ridge. So the details is on this phase. I'm closing the sulcus. You can see. Okay. I'm going to cure it. And now I'm going to the distal buccal cuff. One thing in particularly about the second molar is that the central groove is not going until the marginal ridge. We're going to stop earlier. Let me put another piece of enamel. Okay. So I'm trying to give this a smooth appearance because it's easier to polish and easy to my patient clean as well. I'm going to invert, always going to invert this resin. That's the reason that our instruments, our spatulas need to be very delicate spatulas. So with the brush again, I start to press. Paying attention on the inclinations, taking care of the fossas, thinking in occlusion. So imagine that our second upper molar is here. I have 1 point here on this cusp, and I have 1 point on this cusp. So these walls needs to have the same inclination. So I need to close the fissures. Remember that the light is guiding us to the direction of the triangular ridges. Sometimes we need to open it again. And I really like to use a small pencil as well, a small brush as well, for small details. So I need to think in our triangular lobes. And pay attention, I'm not climbing on the edges. I'm respecting the cavity. Light. Let's go to the final cut. Well, my first concern when I put the resin is to have an enough composite to fill the whole cusp. Look how I failed here. I need to add a little more. Okay. My first concern is about the inclination, so I can cut the excesses of resin. Look, I'm using the reference of my ridges to do this cut. Now I'm going to open the circles again. I really like to polymerize the previous cusp because then I can use the cusp for guidance my spatula. I'm open. Sometimes I need to use the small instruments for invert the resin, and then with the brush I can close the structures, always thinking about the triangular lobe that I need to have here. So I'm closing all these little holes. Let's check the inclinations. Imagine that this is our upper molar biting here. So I can open again and close it again. Well, these images that are you seeing is from a microscope. So I think the magnification helps me a lot on this kind of job. So our work here is to given this differences of inclinations, and I think that's the key to natural look restorations. So I'm going to light cure this. So as you can see, that's don't have many details, but looks like looks okay. We have lighter reflections. Show me the direction of my triangular ridges. I can use a tint right now. Just a moment. I'm going to use a brown for the illusion of a deeper fossa. So as you can see, I changed the point of my brush. It's a very, very delicate point. And I'm going to use just a little bit of brown. Our challenge here is to clean the walls and let the things just inside the fossa and the grooves. Sometimes we spend more time cleaning the walls than applying the thing. I don't like to color all the structures, just the center of my restoration. Let me give another zoom. So that's our restoration. Here I have another. This is the morpho guide, as Dr. Ayat said before. So pay attention on the light reflection. This is really beautiful.
Actually, doctor, what I find very interesting is that you only used somehow two layers of composite. So we're only talking about a full layer of dentin, and then you layered with the bulk enamel composite each cusp. This also is a very fast process. You were explaining during your live demonstration, and it only took around 15 minutes, which means that we can do. Yes, exactly. We hear a lot about the layering techniques right now and everything, but if you are going to look at it from a business perspective, we do need less chair time for the patient. The patient will also be happier if the things are faster during the treatment or the composite fillings. And I think the business owner or the dentist would be happier to see more patients and perform more composite fillings or whatever treatments to gain at the end a higher income. So thank you very much actually for this simple technique, let's say, of filling a huge cavity like this with the higher artistic result.
Yes, I think time is variable because I can spend 3 hours in this tip, So you need to calculate like you said, time because patient need to. Well, it's our time too. So I think training is the key process to make things simple like that. The hand skills are so basic. I think the secret is what's inside our head. Let me open my slides again. I think you can disable the microscope image.
Yes, Mr. Amin will do it right away.
Okay. And I confess my hands are shaking a little bit today.
Well, every dentist doctor has this problem. That's why I think we have to find a second passive income other than the
Yeah,
dentistry to make
I
sure
think
we,
that the live demonstration affected my hands. I'm a
of
little bit
course.
nervous, you know.
Of course, but honestly, thank you very much for the live demonstration. Again, you've used very simple instruments, very simple technique,
Yeah.
but the result is very artistic. So that's what we really need in our dental clinic. Sophisticated layering techniques, etc. I know some dentists that actually charge very well, but they stay in one restoration at least 2 hours. I don't think
Yeah,
from a business perspective it is actually feasible. But yes, it depends on the doctor, it depends on the patient, it depends on the business, perspective. So yeah, anyways, can
and I think the technique it needs to be simple because the students need to know, and then can they need to reply this technique tomorrow, for an example. So
exactly.
I, I I think it's unfair. I show results that I took, I don't know, 3 hours to gain. It's amazing. I love it to do it. So, but this is very simple and very I don't know, basic is the word. There's no, I think it's functional. It's functional in the occlusion
But
vision,
it's
but
aesthetic as well, doctor. You have a very aesthetic
yes,
restoration. It's not only functional. Yes, doctor. We
the
have one
grooves are,
participant. Yes,
sorry.
please continue.
No, I'm saying that functional because in 2019, 2020, I start to do a lot of groups, and then the patients get back to my office with all the, I don't know, dirty on the grooves. So I start to trying to close as much as possible and without losing the naturality. So I think this is the most important because I need to polish, I need to clean, and the patient needs to clean as well.
Of course.
So that's the balance we need to do in aesthetic and functional restorations.
Of course, we'll definitely get to know more about the steps of the polishing techniques and the cavity preparation during your course with us in Istanbul next in 2 months. In 2 months, I
That
think. Yes, in
let
2 months.
me share the program. Let
Of
me
course,
see.
and the science team, please share the link to for registration. We have one of the doctors is asking, using an alcohol swab to clean the instrument, will it affect polymerization? What do you think, Dr. Pedro?
I don't use just if you take time, let the alcohol dry, it's okay. But there are people who use on the brush, and I don't use the modeling resin. I don't use adhesive. Um, I don't know. I'm very static about this. Some things. I think alcohol is not the problem if you let them dry properly.
Mhm.
Let me. Here is the program. So my course is the fourth module of the card program, and it will happen 26, 27, and 28th of November on Istanbul.
Super. And you're covering the anterior and the posterior approach.
Yes,
Of
yes,
course.
as well. And anterior and posterior teeth, and the focus is on morphology. I think if we pay attention on morphology, we can dominate the restoration in any material. So we're going to see that's no a right way to do restorations or morphology, but there's a million wrong ways to do. There's no rules on morphology, but that's many logic on this process, because we need to
So
do something that is beautiful and mainly functional.
super. Thank you very much, Dr. Pedro, for this webinar. We really appreciate all your efforts. I know the time is different as well in Brazil. There's a different time zone. So thank you very much for actually being here and giving all of these valuable information. We'll definitely see you soon in Turkey. And we wish you a great day and a great night for our participants. Thank you, everyone, for joining us today. The webinar was recorded and it will be on YouTube, and the link will be sent to all the registries. So I leave you now, Dr. Pedro, and I leave everyone. Have a great night for those that they're in the evening time, and a great day for those on the other side of the world. Thank you, Dr. Pedro.
Thank you a lot, Dr. Ayat. I want to say that if any participant wants to send me a direct for some questions, I will be ready for this. Okay,
Of course.
and see you in Istanbul in a few days.
See you, doctor. Thank you very much. Bye-bye. Take care of yourself.
Bye-bye.
Bye.